We started with one disease, and today I have done at least 2,000 cases having different applications in 35 type of diseases. I look forward this list in autologous stem cell therapies to reach to more than 80 type of diseases. At this juncture, I would like to add a very important talk to my presentation. In a country like India, where we talk of spending thousands and millions of rupees and dollars on a research for the diseases to be treated, and we don't treat or we don't get the solution to this. As I already mentioned about the potential of endogenous stem cells in the body, which with the simple lifestyle changing, if nature is healing your all the things in the diseased body, what we are suggesting in autologous stem cell therapy is just to have those cells which are in deficiency in those organs, just take them and transplant them. Either we talk of a minimal manipulation, we don't talk of minimal manipulation, we talk of mononuclear cells, whatever it may be. When nature is giving you authority to repair your own body, then what is that stops you to repair from a medical profession to practice this? What is that stops? Because country like India requires this. We can save a tune of billions of rupees. You carry your own repairing kits in your body. This is a dictum which I always teach my patients, which is a very strong feeling. It itself can repair your body totally. What is your role is enhance it. Give the potentials of feeling back to the tissue. You use whatever the modality somebody can say. If you can do it, then why we talk of even storing the cells? 80%, 80 types of disease we can do it, enlist the conditions. From cosmetic to autoimmune to any type of disease you can do it. I don't say you can cure it, but you can improve the quality of life, you can give better than what proven therapies are doing it. These are the cases which I have done at my center. One was the tropical ulcer, 6 months running around there. Again, the basic concept remains in treating this condition is that a protocol using the mode of application, number of cells, type of cells, a disease load, age of the patient, which does matter when you treat to the patient. If you can properly design the program, personalized to every patient, these are the conditions where possibly you can have wonderful results. This is one case which I brought to show you for one reason. If you can see 80% burn lady, can you imagine? Normally in a proven therapy, this would have been a big cicatrice and scar formation there. Her almost every joint was burned. We have used collagen, again a protocol from a bone marrow concentrate, SVF factor, PRP. Only thing what you have to define at what interval you have to give, how much to give. See the results coming in. The lady is healed up with a normal neck shape. She is back to her job. She was an MSCV employee of a state government and has gone back to the same job on which she had that accident. Otherwise, she would have been at home losing her job. Elephantiasis. Can you imagine in our traditional teaching, anyone can say that he has treated elephantiasis. The fate comes in amputation. Fate comes in amputation. Whatever happens, you do it. Simple again, basic components of your body. Bone marrow concentrate, SVF factor, PRP. Only you should know what concentrations you have to take, the route of application, what is the frequency of application. You can see the way foot is healed up completely, the man is back on the job. Never had, in my practice, before I did this case, I could not imagine myself. These are the powers of autologous cells. Ankylosing spondylitis. We always see a patient coming in developed ankylosing spondylitis with syndesmophytes in the spine. becoming a bamboo spine. Chest becomes a rigid cage. He breathes with the abdomen. He is suffering with the pains for getting a life of this kind of pains. A proper protocol, you can mobilize the spine back to the movement flexibility. His neck movements have come back. His rigid chest started blowing with the air. At least 30 to 40% reversal you can achieve in these patients. Diabetes type 1, wonderful results. You don't have to search anything, the babies suffer with uncontrolled glycemias, leading to early diabetic vasculopathies, neuropathies, and become suffering. Wonderful results. Along this, I always insist C-peptidase, which plays a major role in prevention of the vasculopathies in diabetes. This is my favorite topic of avian. This is topic where I have done in at least 110 cases in last 4 years, for which I have already put a patent. I am expecting the results of approval of patent in the 2-3 months. Minimal invasive, using the same composition. Slide you're talking about? Yeah, that's slide of avian patient. Time again, next, in the last slide, I will explain you what we are doing with this project. This is a project which we are working with the Ohio State University. And why I was telling you is that retrospective you can conduct the studies. We are doing a retrospective study with Ohio State for avian on clinical trials, which is also with WIRB presently, and another 2-3 months we are expecting an approval for that. Orthopedic condition, osteoarthritis, need not say, my all colleague friends are enjoying the benefits of stem cell with osteoarthritis. Muscular dystrophy, definitely is a genetic disease. We don't want to say it is going to be cured, but I say you can give a quality life. Most important, when we talk of quality life, we should know, can we give him activities of daily living, ADL in a grade where he can function for his life for self, instead of making him dependent on others. Even if you can give that much, it's more than sufficient for a patient. Did some of the cosmetic work for the hair and facelift using autologous stem cells. COPD, ILD, wonderful results. This is an Australian patient who had a severe COPD. He was under respiratory rehabilitation, and a wonderful recovery for this patient. Again here, what cells to be given in the route of application, the frequency of application has given a wonderful result to this patient. He has flown back with the air again. The video is bad, I don't think you can listen to it much clearly. At Stemaris, what we have done is around 2,000 cases, of which most of the orthopedic cases were there. The remaining ratios I have shown there, with a good amount of results, more than, I would say rather, in autologous